This video demonstrates the method of pin site care recommended by the Northern General in Sheffield. A pin site is where a wire from your external fixator enters the skin. You are at risk of developing minor infections in your soft tissues at these points. Carefully cleaning and redressing these pin sites once a week helps in the prevention of developing an infection. You do need to keep dressings in place for the length of time your fixator is in place. This is the equipment you will need to clean and redress your pin sites. We recommend you find a place that is clean and that you are in a comfortable position to work. After you have washed your hands and put on your gloves, open the dressing pack onto a clean surface holding the edges of the blue sheet. This blue sheet is your clean surface for working on. The yellow bag is for putting your soiled dressings on, and these just get disposed of in your normal waste bin. To open the Prontosan, screw down the lid to pierce the cap. Pour the Prontosan solution onto the large gauze in the tray. This is the gauze that you will use for cleaning your pin sites. Open at least 5 packets of the small gauze onto the blue sheet. With a pair of clean scissors, cut a slit halfway into the gauze, starting at the folded edge. You may shower your limb immediately prior to cleaning your pin sites. Either remove your dressings prior to getting in the shower or in the shower.
To remove the dressing, slide the bung up the wire and ease the gauze away from your skin. Remove all dressings and dispose of in the yellow bag. Once all dressings have been removed, examine your leg to make sure your pin sites all look okay.
Shower your leg as normal. Soaps and shower gels are fine to use. The easiest way to dry your leg is with a hairdryer set on warm or with a clean towel. If the skin on your leg is becoming dry and itchy, we advise you to apply some unperfumed moisturiser after showering and drying your leg. Any excess will then be wiped away when you clean your pin sites.
With the tweezers, pick up one piece of the large soaked gauze and clean around the base of each wire. Apply slight pressure when wiping around, but do not scrub, massage or intentionally remove scabs or crusts. You can use the same piece of soaked gauze for more than one pin site. If any pin sites are irritated, leaking or infected, clean last and with a separate gauze. The antiseptic takes a few minutes to penetrate into your skin to be effective. Do not dry the pin sites once you have wiped them with the antiseptic. Cover the pin sites with the small cut gauze. If you have a pin site that is sore or leaking, we advise you to use more than one piece. Place the gauze around each pin site and secure by sliding the bung back down the wire towards the skin. Your pin sites have now been cleaned and redressed. Carefully discard the used items into the yellow bag and dispose of in your normal household waste bin. Some general information. It is normal for your pin sites to leak a watery fluid. This may be due to increased swelling in the affected limb. If the leakage exceeds half the dressing, then change for a clean, dry dressing. To prevent this from occurring, it is advised to elevate your leg as much as possible. There may be a time when the skin around your pin site becomes red. This may be irritation. Irritation occurs when the pin site's worked hard, for example after your physiotherapy or after a long walk. Irritation usually settles with rest and elevation of the affected limb. You are at risk of infection in the pin sites. The signs and symptoms of infection are increasing pain which does not settle with rest and analgesia, inability to move or weight bear on the affected limb, and a general feeling of unwell, nausea and vomiting. In this instance, it is recommended that you contact your GP for a prescription of antibiotics. The recommended antibiotics can be found on the GP letter that was given to you on discharge by the limb reconstruction nurse. Sometimes an infection produces a thick discharge out of the pin sites with spreading redness and swelling. If oral antibiotics are not improving your symptoms, please contact the limb reconstruction nurses for advice or your GP. You may need to be admitted to hospital for IV antibiotics to combat the infection. If you have a pin site infection, we recommend that you clean the infected pin sites daily with Prontosan and redress with dry gauze. Do not shower the limb until the infection has gone, as this may spread the infection to your other pin sites. If you have any problems or questions, then please get in touch for help and guidance. We hope that you have found this video useful to help to clean and redress your pin sites.